Somalia has received 108,000 additional doses of the Oxford AstraZeneca COVID-19 vaccine to boost the fight against the pandemic in the country. The COVID-19 vaccines were donated by the Emmanuel Macron French government through the COVAX facility in partnership between the Coalition for Epidemic Preparedness Innovations (CEPI), Gavi, the Vaccine Alliance, the United Nations Children's Fund (UNICEF), the World Health Organization (WHO), in a renewed effort to protect Somalia's population from the pandemic that has killed millions of people around the world. Fauzia Abikar Noor, Somali Minister of Health and Human Services, said the arrival of the new batch of COVID-19 vaccines comes at a critical time as cases in Somalia are on the rise. The minister noted further that Somalia will continue to give attention to frontline health and other essential workers, the elderly, and people with chronic health conditions in the next phase of the rollout of the COVID-19 vaccine. Muhammad Ayoya, UNICEF Somalia representative, said the timely support will be critical in increasing the number of people vaccinated against COVID-19, particularly the health workers, so they can continue to provide essential health care for Somali children and their families.
waxaan halkan kula wareegnay airportka 108,000 oo AstraZeneca talaalki oo inoogu deeqday dawladda Faransiiska waana uga mahadcelinaynaa dawladda Faransiiska iyo dawladaha midowga Yurub kaalmada ay nala garab taagan yihiin ummadda Soomaaliyeed.
Somalia to receive 108,000 doses of vaccine AstraZeneca, a donation from France to Somalia. We are very excited about this, as it's coming really at the right moment. We need to have more people vaccinated. And with doses, we are going to be able to vaccinate more people on the ground, and especially the health workers who are in the front line.
Figures from the Ministry of Health showed that an estimated 186,094 people in Somalia have to date received their first dose of the vaccine, and 92,792 have received their second. Owing to low vaccination coverage in the country, where less than 1% of the population is fully vaccinated, the country faces the dual challenge of improving the uptake among its general population, as well as ensuring an equitable and predictable supply of COVID-19 vaccines to support an effective rollout of mass inoculation. To beat the already established challenges, the WHO and UNICEF said they will continue to support the Ministry of Health to ensure the safe and equitable distribution of the vaccines through the management of cold chain systems and in the training of vaccinators and in the monitoring of vaccine utilization. The two UN agencies said efforts will also be geared towards the promotion of the safety and uptake of the COVID-19 vaccine.
On behalf of the World Health Organization, I thank the government of France and the people of France for this wonderful gift to the people of Somalia. These vaccines have come at a time when we are suffering from supply constraint in this country. I'm sure the vaccines are safe, vaccines are effective. I urge all Somali people to take vaccine whenever their opportunity comes. These vaccines will help us for an equitable distribution and equitable access for increasing the uptake of vaccines in this country. I'm sure if we can end the pandemic by using these vaccines effectively, we can end the pandemic from everywhere.
This is part of the COVAX facility, and we really appreciate that this is coming at this time, because indeed it's part of what we have been talking about, the vaccine equity.